Welcome to Career Journeys, a series of videos by the Consortium for Public Education. Here we explore the career experiences and pathways of professionals from a wide variety of careers to help you think about the skills you'll need and the paths you might take after high school.
Hi, I'm Debbie Pixton with the Consortium for Public Education. Today I'm interviewing Heather Rommes, the Director of Program Management at ConnectiveRx. Thank you so much for joining us, Heather.
Thanks for having me, Debbie.
Heather, tell us about ConnectiveRx and your role there. What exactly do you do as the Director of Program Management?
So ConnectiveRx is a biopharmaceutical hub, and that's sort of a lot of words that just means it's the middleman between patients and physicians' offices and the pharmaceutical manufacturers that make the drugs that patients need to get on. And ConnectiveRx's role is helping patients afford their medication, helping them get it quickly, and helping them get access to medication that might be hard to get or difficult to get covered by insurance. So we have, lots of really interesting cutting edge drugs, lots of cancer drugs, some drugs for Alzheimer's that are coming out. It's an exciting way to impact the patient experience and get people on therapy and help people stay on therapy.
Heather, how did you end up at ConnectiveRx? Can you tell us a little bit about your career path?
I ended up at ConnectiveRx in sort of a leap of career faith, I guess. I started my career as the director of social work at a small facility. Social work was my background, counseling psych was my background. I moved from there into a career that spanned 12 or 15 years in working in the patient experience at a lot of different hospitals in the Pittsburgh area, and went from there to doing some training and development with physicians. And through a turn of events and some life changes, I ended up being offered the job at ConnectiveRx as the Director of Program Management. And for someone who had spent the better part of their career working in hospitals, working with patients and families, doing patient experience kinds of stuff, really high touch, really in tune with the clinical aspect of it as well, this is a completely different side of healthcare. It is more of an operations position. And by that, I mean, you think in terms of qualitative and quantitative healthcare, right? Qualitative is healthcare by the people. It's that high touch approach. It's that face-to-face interaction with patients. And then you have sort of the qualitative, right? Working with the insurance benefits, helping people to save money, helping people to be able to afford their drugs and their medication. This is such an interesting company to work for, and it was such a huge change in my career because I had to essentially learn a new industry. Although it is sort of an ancillary healthcare service, it's so very different than the healthcare I was used to.
What are some skills that make you particularly good at this kind of work?
I would tease you and say patience, lots and lots of patience. Patience with a C, not necessarily a T, but and not that that's not part of it, because sometimes there's a lot of untangling that has to happen when you're working with insurance companies and trying to just untangle all of the subtleties. So I would say patience. I would also say organization, being organized, because at ConnectiveRx the pace of play is very fast. It's very fast. The rules and the regulations and what the payers are going to cover and what they're not going to cover, it changes so incredibly quickly. And there's all these different nuances. And so I think that's it. I think it's always like a puzzle, right? And it keeps you thinking of new ways to help, thinking of better ways to solve a problem.
Heather, you've talked a little bit about this, but can you tell us more about how this work intersects with healthcare in the clinical and hospital settings, maybe how it's different, how is it the same?
As someone who has spent a lot of time in the hospitals and some time in the clinical space, I was a regional program manager for some surgical clinics. And so you would see the drug reps that come into the clinics and they want the physicians to use their particular drugs, right? They're out there selling why their drug is the best one on the market to treat what's going on with your patients. Once those pharmaceutical representatives have effectively sold the doctors on using the medication, if the physician can't get access to it for their patient, then all of that work is for nothing. So what they do is, you've got a pharmaceutical rep that comes in and educates the physician's office. You've got a patient that comes in, and that patient has a particular disease process, and the physician says, you know what, I think you'd be a great candidate for drug X. And the patient is agreeable. So the doctor fills out a patient enrollment form. That patient enrollment form comes over to ConnectiveRx. And we have people in patient support services who get those enrollment forms and enter them in and create a case. It goes to a benefit verification agent. That benefit verification agent gets on the phone with the payer, so Blue Cross Blue Shield, Aetna, United Healthcare Group, and they find out all of the specifics about the patient's insurance coverage. Does it require prior authorization? Does it cover this drug? If it doesn't cover it at 100%, what's their copay? What's their, what's going to count towards their deductible? They figure out all of that, and they put it in a verification of benefits that goes back to the physician. And when the physician gets that, when they need additional help, whether it's signing that patient up for copay or patient assistance program, if that patient doesn't have any insurance coverage at all, then it moves to the case managers on my team. And those case managers are going to work directly with the physicians and sometimes directly with the patients. So they're going to work with the clinic and they're going to call the patients. And then we have supervisors and managers and myself. So if there is a problem with an insurance company, like sometimes I get involved if one of my drugs in particular, because there's 2 steps to it, it's very time sensitive. And those case managers are helping get that drug shipped from a specialty pharmacy to the physician's office so the patient can get on that therapy. And if the specialty pharmacy is slowing us down, then we're going to miss that patient's scheduled appointment. We're going to miss that window of time when they need to receive the drug therapy. So our case managers are going to call, and they're really going to keep on the specialty pharmacies. And once in a while, something goes on, and they send out the all call, and they say to me, Heather, we're not having any luck. We need some help. And so I'll call the specialty pharmacy and say to them, hey, listen, we got this patient. We got to do what's right for this patient. Let's go. Let's get this going. And I can call the doctor's office and bring them in and kind of help make that sort of emergency connection.
So Heather, if I have students who are interested in this kind of healthcare work, right? Not in a hospital or a clinical setting and not in a traditional pharmacy setting either. What kinds of questions should they ask themselves to know if this might be a good fit for them?
Can you do a lot of things at once? Because, there's a lot of moving parts. And, are you interested? Well, first of all, are you good on the phone? Because we spend the bulk of our time with our headsets on the phone, whether we're talking to a payer or to a clinic or to a patient or to a pharmacy. But it's a lot of moving parts, right? Because all of those pieces have to line up to get those patients the medications that they need. Are you organized? Are you interested in learning? Because with the payers, you have to learn all of these different, I have one of the drugs that I work with is like a knee injection, like a steroid knee injection. And you have to know that the patient has to have had A, B, and C before they're going to be eligible under this payer. And so we have case managers that work on that drug that help walk those patients through that. So do you like to talk to people? Because that's all we do all day, is either talk to payers or doctors or patients. Do you like to talk to people? Are you good at talking to people? And are you good at figuring out puzzles? Because that's what we have a lot of the time is a puzzle. How do we get the patient to the very best outcome? How do we put all the pieces together and make it match up? One of the things that I think is interesting about ConnectiveRx is that you can come into ConnectiveRx and you can really climb your way up, as far as you can start as patient support services, doing data entry, and you learn a little bit about the industry. And now you're going to be a benefit verification agent, and you learn a little bit more about the industry. And now you're going to be a case manager, and then maybe you're going to be a supervisor, and then maybe you're going to be a manager, and then maybe you're going to be a director. And we have, one of the things that I think is interesting about this company is we have a lot of those success stories, and people learn as they go. And there are people that I work with that have been doing this for, 5-10 years, that know so much, and it's stuff that they've learned on the job.
What's one piece of advice you would offer to students who are interested in pursuing a career like yours?
I think I have 2 pieces of advice. One, if you want to get into healthcare in general, any kind of healthcare. You have to know that healthcare jobs are not the kind of jobs that you walk in at 8:30 and you punch the clock and you sit down and you do your work and then you get up and leave. These are the kinds of jobs that your heart and soul goes into, because you're working with patients. So if you want a job that you're not at all going to be affected by, if you want a job that's not going to touch your heart and is not going to engage your mind, healthcare isn't for you. Healthcare is busy. Healthcare is challenging. Healthcare will teach you something every day. And any job in healthcare, whether it's when I was working in hospitals or with my job at ConnectiveRx, which is sort of on sort of the periphery of healthcare, right? It's not direct care. It's sort of ancillary care. It's all about the patients. I mean, we talk to patients, we hear things from patients, we send out patient satisfaction surveys. I have opened up letters and found either typed pages or Post-it notes that is like, dear so-and-so, thank you for your help. I couldn't have done this without you. Dear so-and-so, our conversation was so great. You're so kind. You have such a good heart. I don't know how I'd have gotten through this without you. It's those kinds of things. So if you want a job that doesn't sort of touch you and bring you in, then healthcare is not for you. But if you want a job that has that internal value, right? That sort of warm and fuzzy, that getting up from your desk at the end of the day and saying, I made a difference in somebody's life, then healthcare is the kind of work for you.
Heather, this has been really wonderful. Thank you so much for sharing your thoughts and experiences with us today.
Thanks for having me, Debbie. It's a pleasure.
For more information or to learn about other careers in the Career Journey series, visit our website and check back soon for our next installment. Thanks!